This video covers the embryonic development of the atrial septum and the ventricular septum. And first I would like to start with the atrial septum. So there is a structure called septum primum, and it keeps growing downward during embryonic development. Now the hole that remains in between the right atrium and the left atrium is called foramen primum. So once the septum primum grows downward, in the next step it will start to develop perforation in the septum primum. So a new hole will be formed, which is referred to as foramen secundum. And then after that one, there would be a septum secundum that grows on top of septum primum. So first we had septum primum, then there was perforation in that, and then a second septum grows on top of septum primum. And this structure is now referred to as foramen ovale. Now the function of foramen ovale is to shunt blood away from the right heart to the left heart, and the reason for that is that fetal lungs are not inflated, and thus there is no point for the entire blood circulation to go through the lungs. So there is this is a mechanism through which blood will be shunted away from the right side of the heart to the left side. However, once the fetus is born, there would be blood flowing into the lungs, and then there would be more blood returning to the left atrium, and thus pressure in the left atrium increases, and after that septum primum and septum secundum fuse to each other, and thus foramen ovale closes. Now what happens is that if there is too much perforation of septum primum, or if the size of septum secundum is too small, then these patients will develop atrial septal defect. And the murmur of atrial septal defect is characterized by a fixed split S2. And what I mean by that one is that there are two heart sounds. One is S1 and 2 is S2. And S2 is divided into two heart sounds. One is the closure of aortic valves, followed by the closure of the pulmonic valves. Now if an individual takes a deep breath, since there would be more blood flow into the right ventricle and thus the pulmonary arteries, then it takes longer for the pulmonary valve to close. So the distance between A and P increases with inspiration. In patients with ASD, however, the distance between A and P is fixed. So deep inspiration doesn't affect the split S2. The next structure I would like to talk about is the ventricular septum, which is derived from three different membranes. So here is the ventricular septum, and what the first structure that is derived from is membranous ventricular septum. So membranous ventricular septum grows from the bottom. And then the second structure would be the endocardial cushions, which grow from the sides. And then from the top, the aorticopulmonary septum grows and makes the ventricular septum. So just to repeat that again, ventricular septum is made of the membranous ventricular septum, endocardial cushion, and aorticopulmonary septum. Now defect in any one of these structures can cause a ventricular septal defect, which presents with a harsh, hollow, systolic murmur. I would also like to mention that the function of the aorticopulmonary septum is to divide the truncus arteriosus into the aorta and the pulmonary trunk. Now in patients that have partial development of the aorticopulmonary septum, two conditions will arise. One, persistence of truncus arteriosus. And what I mean by that one is that there would be a region in truncus arteriosus where the pulmonary trunk and the aorta are actually mixed together, so the blood will be mixed. In addition, since the ventricular septum is developed from aorticopulmonary septum, these patients will always develop a ventricular septal defect. However, the symptoms in patients with persistent truncus arteriosus is much more severe than VSD, and they usually manifest symptoms in the first week of life. So common causes of ASD and VSD include Down syndrome, as well as a fetal alcohol syndrome. And these patients usually present with recurrent pulmonary infections, and that is due to pulmonary congestion. And since there is also overload of blood in the left ventricle, they also develop congestive heart failure. So recurrent pulmonary infections and congestive heart failure are commonly associated with VSD and ASD. And that concludes our discussion.